Hello, let me give you a brief overview of the article titled SCD1 fatty acid desaturase inhibitor MF-438 alleviates latent inflammation induced by preservative-free prostaglandin analog eye drops. To begin with, glaucoma is a chronic optic neuropathy that can result in vision loss. Topical eye drops are the first line of treatment, with prostaglandin analogs as a recommended first choice in therapy. Historically, all eye drop formulas have contained preservatives to make the eye drops sterile for long-term application. Unfortunately, preservatives in eye drops have been identified to have detrimental effects on the eye surface, leading to chronic inflammation, redness, and dry eye syndrome, which all affect patients' compliance. To improve the tolerance of topical treatment, preservative-free formulas have been developed to reduce negative impact of these substances in therapy. However, the most commonly used preservative-free prostaglandin analogs contain other excipients, such as detergents, which may also have negative effects on eye surface structures and may induce latent inflammation. Therefore, the aim of this study was to evaluate the effect of an SCD1 inhibitor on the differentiation of monocytes exposed to saturated fatty acid derivatives in eye drops. To achieve our aim, we used in vitro culture of human peripheral blood monocytes. The cells were exposed to eye drops containing fatty acid derivatives, monoprost, taflotan, as well as monoprost with the inhibitor of SCD1, only MGHS40 and PS80. For the negative control, monocytes were cultured in basal medium, and for the positive controls, monocytes were stimulated with LPS and interferon gamma towards M1 macrophages, or interleukin-4 towards M2 macrophages. The cells were cultured for 8 days and the medium was changed every 3 days. The concentration of the desaturase in the cell homogenates was determined by ELISA. The cells were counted in ImageJ software. Our results were such that exposure to tested substances resulted in different concentration of SCD1 in cell homogenate. The level of SCD1 was very high in monoprost, however, adding SCD1 inhibitor to monoprost significantly decreased concentration of SCD1 in culture when compared to monoprost itself. Furthermore, there was a strong correlation between SCD1 concentration and macrophage count in the culture. The higher the level of SCD1, the more macrophages were present. In conclusion, I would like to state that inhibition of SCD1 desaturase in monocytes prevents their transformation into macrophages after exposure to saturated fatty acid derivatives contained in eye drops, which may contribute to the limitation of latent inflammation within ocular adnexa and therefore improve eye drop tolerance.